Good afternoon. A couple of weeks ago, there was a presentation given to the Barry-Eaton Health Department, and I wanted to go over the some of the slides in the presentation and maybe give a different perspective on how to look at some of the same data that was presented. On this first slide that I have here was page 3 from the presentation that was given, and it shows here on the left a spike in hospitalizations in the United States from ages 0 to 17. So that spike represents 0.35 out of 100,000. So I think that spike, although it may look alarming, is quite misleading because of the small scale that it's representing. Here's the same chart that is isolated, and again showing a spike here in 0.35 per 100,000. Now, if you break that down to Michigan, that table axis of 0.35 per 100,000 and 26.1% of Michigan's population falling between 0 and 17, Michigan's population being just under 10 million, that leaves the 0 to 17 population at about 2.6. If you take 2.6 million and you do 0.35 for every 100K, it represents 9 hospitalizations over a 7-day period. So again, this spike may look alarming, but it's very misleading because it only represents 9 children hospitalized in all of Michigan over a 7-day period. There was on page 4 of their presentation, they spoke about community transmission. Now, the next slide I have here is the same data or the same bullet points that they spoke about. And one of the ones I want to kind of isolate is the completed vaccination and how they're throughout this deck, we hear the vaccination of persons 12 and older. And why I think that that's quite misleading and a meaningless representation of the data is because the greatest risk is clearly the folks 70 and older, right? Where 80 and older, there's a 75.83% survival rate. 70 to 79 is 90% survival rate. So 1 in 10 for 70 to 79 are dying with COVID, and 1 in 4, 80 and older, are dying of COVID. When you talk about the younger population, anybody 29 and younger, there's a 99.95% chance of survival, 20 to 29, 99.99% chance of survival in 10 to 19, and 99.99% chance of survival in 0 to 9. So those clearly at a higher risk are 70 to 79 and 80 and older. The great news is that in Barry and Eaton County, our 65 to 74-year-old population is vaccinated at 85% rate, and 75 and older in Barry County at almost a 91% rate. In Eaton County is even better. 65 to 74% of our 65 to 74-year-olds are vaccinated at 90%, and all of our seniors 75 and older in Eaton County are vaccinated. So those at highest risk are vaccinated at the highest rate. And I think that's what we should be thinking about when we're talking about vaccination rate. This slide was page 5 of their deck, and it shows a 7-day average of 2 hospitalizations in all of Michigan from 0 to 17 years old, and it shows a 77% decrease in hospitalizations from the peak in April. So I'm not sure what was trying to be sold here, but it does show that hospitalization is rare in Michigan for ages 0 to 17, and that it's down significantly from its peak in April. So community transmission rate in Barry County, 14.4%. This is page 6 from their presentation. Total cases of 65 over a 7-day period, hospitalization for COVID at 5%. And again, it talks about the 12 and older vaccination rate. One thing that I think is misleading when it comes to positivity rate is how positivity rate is actually figured out. So the positive cases being the numerator against the total number of tests taken being the denominator. And if we understand why somebody would actually go get a COVID test, it would be those that have symptoms. So if somebody has a symptom that they believe may be COVID, they're going and getting a test. Now, what we're finding out is that 14.4% of those that actually feel like they may have COVID and are getting tested are indeed positive. Now, one way to look at that is 14% of the people that are taking the test is positive. Another way to look at it is more than 8 in 10 of those who believe they may have COVID symptoms are coming back not having COVID. They spoke again here about the vaccination rate of 12 and older, and I'm going to kind of reiterate the exact same information that we talked about on the previous slide, which is those at greatest risk of COVID being our seniors, here 80 and older, and here 70 to 79. Those are at the greatest risk, and both of those populations in Barry and Eaton County are vaccinated at very high rates. On page 14 of their deck, they spoke about how the Delta variant is the dominant variant in Michigan. There's 1,000% increase in viral load. It's 200% more transmissible, and one person infects 7. So the interesting thing about it being more transmissible is from the Michigan data that shows all of the spikes from the very beginning. So here is the beginning of COVID, and then here is the big spike in the wintertime. Here is the April spike that we've seen, and then here is our Delta. Now, clearly, Delta doesn't have near the amount of transmission currently in Michigan that either of the previous two, or even if you want to count this as a third mini spike here, doesn't even measure up to any of those other points in time when we're talking about COVID. And this is the highly transmitted Delta variant. Another thing is the data shows that the Delta variant in Michigan is not more lethal. So they're saying that the virus sheds more. We just showed on the previous slide or the previous data in Michigan that the cases aren't even as high as the previous ones. And here is the death measuring the same peaks. So Delta is showing right now to be less lethal than at any point previous for COVID. Page 15 of their deck started to speak about COVID-19 in children. And children can experience severe outcomes, MISC, hospitalization, and death. They spoke about it being a top 10 cause for death in adolescents in Michigan, or actually in the United States. Talked about MISC. It speaks about MISC again. And then it talks about being 4 times higher hospitalization for COVID than influenza. And this came from a study by a pediatric study. Now, I have the full conclusion of the pediatric study on page 23 of this exact study. And interestingly, there were some important things left out of that quote. So here is the conclusion of that study that was quoted on her page 15. COVID-19 affects children and adolescents of all ages, but severe outcomes are reassuringly uncommon. So all of this is about saving children and keeping children safe. And the conclusion from this study is that severe outcomes are reassuringly uncommon. That's great news. And that's what the data tells us. So leading causes of death in Michigan. Now, COVID does reach into the top 10, and mostly because there aren't a lot of reasons why children under 20 um, die, and that's great news. So all causes is 1,200 in 2019. Here we have in 2020 we have 7, but they also have 14 as 2021 to date. But actually, it is 2021 to date would be all 18 months of data. So it's really another 7 deaths so far this year. What we've seen in 2019 in Michigan is that flu and pneumonia were higher death rates than COVID in 2020 and COVID so far in 2021. And I don't remember us ever going to masking our children because of an influenza breakout in any of our schools. There was also mention of MISC on that page 15. Now, I'm not going to spend a lot of time here, but from the Mayo Clinic, I pulled down the symptoms of MISC and the symptoms of Kawasaki syndrome. There's 3,000 cases of Kawasaki in the United States every year, and it always is in children 20 and under. The symptoms between Kawasaki and MISC are almost identical. On the CDC website, it mentions that the Kawasaki disease, they don't really know what causes it, but they did mention that it always follows a viral infection. So does MISC. On page 15, the mention of hospitalization for COVID being 4 times more likely from that study. But then we also saw in that study, it talked about the uh, severe outcomes being very rare. So here is 18 months of COVID deaths, and here is 2019 flu deaths. What you'll see, and this is in the United States, there are more deaths from flu in 2019 than 18 months of COVID. You're more likely to die from the flu if you are 17 or younger than you are of COVID. And again, I don't remember us talking about masks on our children for during any flu season, and my children have been going to school in this county for the last 17 years. Those at the highest risk of death, we can see here, COVID, very high risk of death. We already know from previous data and from the Barry-Eaton County website that those at the highest risk are already vaccinated at a very high rate. That is great news. They are protected in our community. Our children do not need to be protected by masks. So let's remember that when this discussion comes up. On page 19 of their deck, they spoke about last year's diagnosis or outbreaks of COVID in the schools, and it mentions 5,000 students were identified. what I did find to be interesting is they talk about outbreaks at 45, and an outbreak can be as little as 2 folks. Now, that is in my opinion, a very low bar for a an outbreak. I can remember many times during the course of the 17 years that my children have gone to school that more than 2 folks have been diagnosed with flu at a time, and I don't ever remember it being spoke about as an outbreak or talking about quarantining children. And again, we know that you're more likely to die from flu than you are from COVID if you're 0 to 17. So let's talk about the close contact quarantine and what actually happened for these kids. The data of 5,000 kids who were sent home because of close contact quarantine, 4,750 of those children missed 4,750 learning days for no reason. They did not come in contact or they did not contract COVID-19 from that close contact. So we took away those learning days from them for nothing. This is proof that close contact quarantine was and is unnecessary. This is an interesting slide because it gives this very scientific looking um, uh, information about a mask. I'm not sure what mask they're referring to, but I'm going to draw some conclusions. This is blue with a white interior, and this looks like the blue surgical mask that you can buy at just about any store these days. The interesting thing about this particular mask that I believe that they're talking about from page 33 on their presentation is on the box itself it says it does not protect you. So we're talking about protecting kids with a mask that the manufacturer says does not protect. Thank you for your time.